important what you consume while your brain is growing. Right? So today we're going to be talking about what is marijuana, cannabis, preparations, and mode of administration. The main topic is the dangers, but I'm gonna have to level it down a bit so you can understand the science behind it, behind the dangers. When I'm finished with most of these, I don't think I even need to explain the dangers because you'll understand. What do we know in our science community? The psychoactive components and the neurobiology of cannabis use, short-term health effects of cannabis use, long-term health effects of cannabis use, and is there a link between cannabis or marijuana use and psychiatric disorders? And this is the one that I added in that last one because of what we've been seeing here in Antigua, right? My personal addition. So, what's marijuana? Marijuana is also called weed, herb, pot, grass, bud, ganja, Mary Jane. We have a whole other name for it, right? In the United States, we have even more names. But what's important to understand here, right, is that marijuana contains more than 0.3% of THC, right? And you differentiate marijuana from hemp because hemp has less than 0.3% of THC. I'll say it again, right? I'm gonna explain what THC is afterwards, right? So marijuana has more than 0.3% and hemp has less than 0.3%, right? So what is THC? Before we go into that, how do we consume marijuana? Modes of administration. We smoke it, right? Most of us know it that way in Antigua, right? So you roll it into cigarettes, we roll it into something that's called bamboo here in Antigua, right? And we smoke it. We roll it at times in tobacco. I think that's what they call beanie also, right? They mix it with the tobacco and smoke it. Call it blunt also. It is brewed in teas. It is mixed into food as edibles. So we cook it, make our brownie, candies, cookies. A lot of us know it this way, right? They also have vaporizers, which they use to consume marijuana. And this is the point at the bottom here. Stronger forms of marijuana include sensimilla. So a lot of you have heard of sensimilla before. You heard them sing it in songs, right? And this is from the female plant. This is the most this is the oil, concentrated oil that's found in the female plant that they use, right? And some names for it are like hash oil, wax butter, and shatter. Move on. Myths. Common myths. And these are myths and not facts. Okay? Marijuana is harmless. Is it? You can find out afterwards, right? Marijuana is not addictive. When I go into the neurobiology of it, you'll understand. Marijuana is not as harmful to your health as tobacco, right? Marijuana makes you mellow. Marijuana is used to treat cancer and other diseases. And marijuana is not as popular as ecstasy and other drugs among teens today. And this is a discussion point which I place in it. I want to have a pause here. And it says, do any of these myths that you read above, I'll go back to it, surprise you? And did you previously think any of these myths were actually facts? These are the myths before. Any surprise here? Anybody surprised? And did any believe that marijuana is harmless, that it's not addictive? Any surprises here? Or is all this already known?
Well known, no surprises.
Okay. So these are myths, not facts to you? Hello?
Yes, myths, but I've heard them before. So they're well known, but
you've heard them spread in the community before, right?
Yes, but they're myths, as myths.
All right. So what I'm going to do today is actually go through so you can understand why they're not facts, right? So when you have your point and you talk, you know this is what it is. Okay? All right. Let's
Doc,
move on.
before you go on, Doc,
Mhm.
the one that he said that they use is for medicine. We all know it's not proven, but it's all over that they use it for glaucoma and other things. So
Yeah, we'll get into that soon. Yes. Right? We'll get into that soon.
okay.
So hold on for a while. We'll move on into that right now. Right? And this is the point. I'm happy you brought it up because this is the first point I have right here. That what do we know? Right? So we have CBD, which is the name you see right here, right? And THC. There's a difference between CDB and THC, right? And in marijuana, you have actually 130 compounds of cannabinoids, right? The two most important ones that we have here is CBD and THC, okay? Remember, hemp, as I mentioned before, is the cannabis sativa with less than 0.3% of THC, and marijuana has more than 0.3% of THC. That's the difference between the two, all right? But the two compounds that we're gonna look at, the two main compounds is CBD and THC. THC stands for delta-9 tetrahydrocannabinol, all right? That's what the THC stands for. Let's move on. The main psychoactive mind-altering chemical in marijuana responsible my throat is getting dry. I pause for a minute. Anything is fine. So the main psychoactive mind-altering chemical in marijuana that's responsible these are all facts, right? Inhalation by smoking or vaporization releases marijuana is absorbed into the system within 15 minutes, right? And the half-life of marijuana or the THC is 2 to 3 hours. All right? I'll say it again. When you smoke, it is absorbed into your system within 15 to 30 minutes, the THC. And its half-life, or it begins to decrease. Doesn't mean that it comes out of your system, but it starts to decrease within 2 to 3 hours. Okay? THC is highly lipophilic. And that means that it is your fat cells can actually absorb the THC. That is why when we test for THC use in our patients, it can stay in your bloodstream for up to a month. That's because it is absorbed into the fat cells, right? And when you burn off your fat cells by exercise, walking, whatever you do, it is released back into the bloodstream. All right, this is the part that's important right here too, right? The changes in the potency of THC. So back in the 80s, remember again that marijuana is classified as having more than 0.3%, and hemp is less than 0.3% of the THC. So back in the 80s now, you had the cannabis or the THC content less than 2%. Okay? And then it began to rise. So from 1997, you have 4.5. In 2006, you have 8.5. In 2008, the THC level has risen to 8.8. In 2015, you had up to 20%. And now in 2020, you have up to 24% of THC. And as you increase the THC, the CBD drops down. Okay? So if you notice, this is the point I want to make too, right? If you notice, a lot of people are getting sicker now from marijuana use. And one of the reasons is because the THC in the marijuana that we use now is so potent that we're having faster psychoactive symptoms in people who are smoking marijuana because of the potency of the THC. All right? Is that understood?
Yes.
Now, the part of the medicinal part of the cannabis is the CBD. Okay? And we're going to here with the psychoactive components and the neurobiology of cannabis use. The medicinal part, or I want to say the good part, so it's a plant, so there's no bad and good for me, right? But the medicinal part is the CBD. However, the CBD does not give you a high, right? Doesn't make you feel, one word, satisfied, but it doesn't give you the high that most desire from smoking marijuana. So what has been happening over the years, marijuana has been modified to increase the level of THC so that you can get that high feeling from it. So a lot of the marijuana use recently, right, as time passes, is to get the high. All right? All right, so the psychoactive components of cannabis use. Right? So endocannabinoids play an important role in the brain development, even before a child is born. They help to control how many and what type of brain cells are produced, how these cells migrate to find their position in the brain, and how they connect with each other. Important, right? So what is this endocannabinoid that I'm talking about? If you look at the diagram that's here now, you can see the human endocannabinoid system, right? And you see the compound THC, you see CBD, and you also see CBN. Those are all chemicals within the marijuana, right? In our bodies, we have two types of cannabinoid places that are receptors in our bodies, right? You have CB1 and you have CB2. These get the names from the cannabis plant. We didn't know, now you know. The cell receptor endocannabinoid system got its name from the cannabis plant. Okay, because they found out from research that the compounds within cannabis actually were taken in by the receptors in the body, right? So the THC is the key that unlocks the receptor in the human body also. I'll show you right here, right? It says here, CBD, CBN, and THC fit like a lock and key into existing human receptors. Those receptors are part of the endocannabinoid system, which impact psychological processes affecting pain modulation, memory, appetite, plus anti-inflammatory effects. So the CBD, the medicinal part of marijuana, this is basic. Remember, it's also a key, right, which unlocks the receptors. So yes, CBD is used for pain. It is used to increase appetite. It has an anti-inflammatory effect, and it helps with our immune system. The CBD, right? Let's move on. The endocannabinoid system comprises of these two receptors I mentioned before, right? Here you have it. It's an example. This is where it gets complicated, right? But bear with me. So in the brain, you have receptors, right? And these right here are the end of neurons. Neurons are the brain cells, all right? So at the end of brain cells, you have neurons, right? You have what's called a presynaptic and a postsynaptic, right? So the presynaptic is the one that's giving signals to the postsynaptic. So in the postsynaptic now, you have what's called receptors. These are like locks, right? And the cannabinoid receptors are actually in these nerve endings. Remember the importance of the cannabinoid system. It helps to regulate formation of the brain, right? Our body also creates a hormone called, I'll move on, I'll explain that afterwards. I don't want to get too complicated. So it says here, brain cells, neurons communicate with each other by sending chemical signals throughout the brain, right? And they cross this gap in the brain. So I explained before the presynaptic and the postsynaptic, right? Our body does produce cannabinoids. If you read right on cannabinoid, it says natural chemicals produced by a body, such as the 2-AG and the anandamide. They are natural chemicals produced in our body, and these chemicals are similar to THC and the CBD. Okay, so these are the natural chemicals in our body. So when we smoke, when we take marijuana, what happens is that the THC or the CBD unlocks the receptors that these chemicals would bind to. Am I being too complicated, or is it understood? Anybody? Hello?
We're listening.
Yes, we're here.
Is it being understood?
So far.
All right.
Yes, we are learning.
All right. So the hippocampus, which helps to form our memories, and the amygdala, which helps to govern our emotion, our memory, and fear, both have a heavy concentration of CB1 receptor, right? I'll go back. If you notice the color of the THC here and the color of the CB1 receptor. So the THC unlocks a lot of the CB1 receptors in our brain, okay? And our hippocampus, which helps to form a memory. This is why a lot of people, this is where we're gonna get to the short-term effect of the marijuana and the long-term effect of marijuana use, because our hippocampus and our amygdala are responsible for governing our memory, fear, emotions also, all right? The brain's dopamine reward pathway contains both CB1 and CB2 receptors, right? Animal and human studies indicate that these receptors respond to the THC by increasing dopamine release, and effect that probably explains the euphoric effect of cannabis. Now, what is dopamine? Does anybody know? I don't need to answer, I'm going to explain it to you. So dopamine is basically the chemical that is secreted to make us feel good. All right? And this is why when people tell you that marijuana is not addictive, you just ask them, does marijuana cause the secretion of dopamine? And the answer is yes. Hence, it becomes addictive. However, marijuana does not cause secretion of dopamine as much as cocaine or crack. It's not as addictive as cocaine or crack, but it does cause secretion of dopamine like sugar does. And you know how much sugar is addictive, all right? So this is where, when the myth that says it is not addictive, just ask them, does it secrete dopamine in the brain? The answer is yes, hence addictive, right? This is where you get the high from, the feeling of euphoria, right? You get that from the secretion of dopamine within the brain, okay? Dopamine is involved in the control of cognition, attention, emotionality, and motivation also, right? So we get into the short-term and the long-term effects of marijuana. And by now you should know, based on the psychoactive and the neurobiology of marijuana, how it works. So the first one, impaired short-term memory. Remember, it affects the hippocampus and the amygdala, right? So smoking it impaired our short-term memory, making it difficult to learn and to retain information. impaired motor coordination, which means slower reaction time, altered judgment and distorted sense of time, increase your heart rate, increase your appetite, and euphoria. All right? Now, I want to pause here for a while, and it's important. Imagine you have someone who started smoking at the age of 11 or 12, when their brain is starting or in the middle of forming, and you flood that brain with cannabinoids from outside the body. The endocannabinoid system is responsible for maturing the brain, right? So if you start to smoke from a young age, you're stopping the brain, you're hindering the brain from its proper formation. That is why a lot of smokers drop out of school early, right? That is why a lot of smokers have difficulty learning, right? When I say smoking, I'll explain after. Let's move on. In high doses, marijuana can actually cause paranoia and psychosis. And psychosis, which is hallucination. So they hear voices and they see visions. Okay? However, I said it's a short-term effect, so it's temporary, right? As long as the THC is within you, then you can have paranoia and psychosis. Okay? Temporarily. Long-term effect, altered brain development. If you start smoking from a young age, the THC would cause altered brain development, right? Here in Antigua, we have a lot of young people who start smoking third form. A lot of my patients we have up at the Cleary Psychiatric Hospital, the majority start to smoke at third form. So that's within 13, 14, 15 years old, okay? And the effects, you don't start to see the long-term effects until they hit 23, 24 years old, all right? Cognitive impairment with a decline in IQ. And that's a good way of putting it, right? Cognitive impairment with a decline in IQ. Your IQ can actually drop by 8 to 10%, well, 8 to 10 points, right? And that can be enough to decide whether or not you pass to go to college or whether or not you pass to go to university, right? A drop in IQ is very bad, okay? Poor school performance and a higher chance of dropping out. Impaired thinking and the ability to learn and perform complex tasks. Lower life satisfaction. You find yourself being unable to be pleased, right? A lot of the times. Addiction, I just mentioned before. Potential development of opiate abuse, right? Symptoms of chronic bronchitis. And we have an increased risk of chronic psychotic disorders such as anxiety, depression, and schizophrenia. Okay? So, is there a link between marijuana use and psychotic disorders? And yes, I'll answer the question right away. Right? Long-term use of cannabis, especially those with high potency in THC, has been linked to schizophrenia, especially. All right? It says here, marijuana causes temporary paranoia and psychosis. Regular cannabis use has been reported to be more common among persons with schizophrenia. The regular use of cannabis with higher THC content and a lower CBD concentration may increase the risk for schizophrenia and lower the age of the onset of the disease. I'm not saying that this alone causes schizophrenia, but it's a risk factor involved in lowering your age to get it. Okay? The drug that mentally ill people use the most is marijuana. In Antigua, 99% of our young men who have been diagnosed with schizophrenia are marijuana addicts. Okay? So, this is the part I want to mention here. I just added this into, and this is the last part. It says, mental health and psychosocial outcomes of long-term cannabis use. Cannabis dependency is a cluster of behavioral, cognitive, and psychological phenomena that develops after repeated cannabis use. A diagnosis of dependency requires 3 or more of the following criteria that are met in the previous year. So you have a year, and we see if you can be diagnosed with it. Okay? It says a strong desire or sense of compulsion to take the substance. A lot of our young men say that they can stop when they want, right? It's nothing, they can stop when they want, they don't need no help, etc. And we know differently, right? Because it is addictive. You have a strong desire and a sense of compulsion to take the substance, right? Continues. Difficulties in controlling substance taking behavior in terms of its onset, its terminations, and levels of use, right? A psychological withdrawal state when substance use has ceased or been reduced. When you stop smoking, your behavior changes. You have withdrawal, and yes, you do have withdrawal, okay? Says here, D, evidence of tolerance, such that increased dosage of THC are required in order for you to produce the same effect as a lower dose. So this means that you have to smoke more weed for you to get high, right? One not gonna work no more. You have to smoke 2 and 3 a day, 4 times a day in order for you to get the feeling, right? You have to smoke higher levels of, you have to change from the Antiguan weed to the Vinci weed because the Antiguan weed don't work no more. And after a while of smoking the Vinci weed, you have to change from the Vinci weed to the Jamaican weed because the Vinci weed and the Antiguan weed don't work no more, right? That's evidence of tolerance. Progressive neglect of alternative measures of interest because of the psychoactive substance use. Increased amount of time necessary to obtain or take the substance or to recover from its effect, right? So you stop playing cricket when you used to play it, you stop playing football, you no longer go to church or AY because you have the need, your friends change, right? Let's move on. It says here, persisting with substance use despite clear evidence of overtly harmful consequences, right? So let's say a drug user in the church, they come, they speak to the pastor, or they speak to an elder, they speak to the pathfinder director or the AY leader, and you can explain to them, you can see with your eyes that something harmful is happening to them. You try your best to explain, but because of the impairment in the cognitive function, it is extremely hard for them to understand, right? And they usually say that it's okay, nothing is wrong, and they begin to what we call lack insight. They cannot see that there's an issue with them anymore, right? And they believe it is harmful and it doesn't do them anything, right? Even we have one, let me give you an example. We have one a patient we're seeing has lost weight, a female, so much weight that she had to be hospitalized at Mount St. John's, right? And she actually left her home to live on the streets, right? And the only thing that changed with her lifestyle was the smoking, right? As far as we can tell. Okay, and in spite of us pointing that out, that this is what you said changed over the past few years, that's the only thing that has changed for you, right? and she cannot see it, right? Even with how she looks. Okay, so continue. He says here, persistent with substance use despite clear evidence of overtly harmful consequences, such as harm to the liver through excess drinking, that's for alcohol, right? Moods or depressive mood states consequent to periods of heavy substance use or drug-related impairment of cognitive functioning. Efforts should be made to determine that the user was actually or could be expected to be aware of the nature and extent of the harm. So even if we had one who we asked for his birthday and he could not tell you his birthday, right? We asked him for like the day of the week that he came to see us. He could not tell you the day of the week that he came to see us, right? He knew his name, okay? But his birthday, how old he was, and he had been smoking since he was 13 years old, dropped out of school, and his brain development is extremely lacking. Remember, this doesn't happen one time, right? It usually doesn't happen from one smoke. It is consistent over the year periods of smoking, and the THC causes all the impairments that we just read before. Okay, and that is the end of the presentation. If you have questions you would like to ask, you can, and I'm willing and hopefully able to answer.
I'd like to ask a question or two.
Uh-huh.
You mentioned the hemp.
Uh-huh.
Is that dangerous?
Hemp has lower than 0.3% of THC. So no.
No,
Hemp
it's
is
not.
smoke, right? Yeah. The THC, the THC is lower, is 0.3%. We have the psychoactive issues with THC that are high. The higher the THC, the higher the psychoactive ability of the substance, right? So if you wanna, people use CBD oils, right? For massages, for seizures, for multiple sclerosis, for pains, right? Medically, it is okay to use, right? Remember this, right? I don't want to demonize hemp or marijuana or that kind of stuff, right? It's a plant, right? However, because of what marijuana is in our society, right? A lot of us have began to demonize it, right? Of note, it has changed over the years, as was shown before, right? From 1988 onward, where the THC level was low, to now in the 2020, where the THC level has reached 34%, right? You have marijuana being made now, right? Different from what it was in the past, right? We have people who drink hemp as tea. The good part of marijuana is the CBD. If you can get the plant with extremely low levels of THC and higher levels of CBD, then it can be used. Nothing should be smoked. Let me make that point. Nothing at all should be that is burned should be put into a system. So we should not smoke anything. All right? That's understood?
Yes, but I have another question.
It can be used. Wait, a point I'm trying to make, right?
Okay.
We do not know how the THC in Antigua is. We don't know the marijuana is grown in Antigua. We don't know what level of THC we have here in Antigua. All right? So when we use it in our teas and our cookies and stuff like that, we don't know the level of THC in Antigua. Right? But from the cases we get at Clearview, I know it's not low because our young men are increasing or having psychiatric issues more frequently than before. I've worked at Clearview now since 2014, and we've been getting, as time passes by, our cases increase dramatically with young men and women at our hospital. I know it's not a 0.3% or 5%. The the THC level is probably higher than that. So if you're going to use it to make tea, if you're going to use it to, I don't recommend putting cookies, stuff like that, but be careful, basically, right? Mm-hmm. Never smoke.
Okay, there's a question on the board, Doc.
Yes.
And yeah, you just mentioned part of it. You said, will drinking marijuana tea have the same effect as smoking it? And I heard you just say be careful. So,
Yeah,
but you may
yeah.
want to elaborate.
Careful. Remember, I'm not, marijuana is a plant. As people always say, it is, God made it, right? It's like spinach. It is like spinach. We eat it, we can eat it, we can put it in our salads, etc. But here in Antigua, we do not know the levels of THC. Marijuana is being made now to get the effect of the high. That's the purpose of them making it now, right? They make it to sell it. You can't sell it if it doesn't give you the high. Nobody on the street is gonna buy it without that high. So it is being produced now to get the high. The high is caused by the THC. So what they've been doing is reducing the level of the CBD and increasing the level of the THC. And that's the problem.
I have a second question.
Yes.
Can someone use marijuana for the first time and it has it damages their brain? And if so, what would be the reason for that?
The possibilities are not extremely high for that. If it's the first time, it is not known that first-time users get immediate brain damage from using marijuana. Then again, it would depend on the high level of THC, right? Because if somebody smokes a 34% THC level marijuana, yes, they're gonna have problems, right? Immediate short-term effects, which may last longer. If your brain is developing, when I was reading up on the marijuana, let me give you the name right now, right? 34%, right? We call OG cannabis. You also have the cookie cutter. You have a different name for them, right? If somebody smokes something with 34%, possibly, right? But usually, one-time use does not cause permanent long-term effects, right? Understood? Now, before we move on, let me make a point here, right? Marijuana is not the only plant that has cannabinoids, right? You can find cannabinoids in sunflowers. You can find it in echinacea. If you don't know, you drink echinacea tea, right? You can find it in black truffles. You can find it in black pepper. You can find it in cacao, chocolate, right? So these are a few that we use here in Antigua that we know about, right? That has endocannabinoids, or they have cannabinoids within them also. So it's not just the marijuana plant alone that has it. All right? Questions?
A question. Can secondhand smoke from marijuana
affect you?
Yes.
It can, yes.
Thank you.
It can affect you, just like nicotine can. Right?
Thank you.
Do you know that right now a lot of people who smoke marijuana are bashing nicotine or bashing tobacco? All right? Just like marijuana and CBD. CBD has good effect. Nicotine actually has positive effects also, right? So it's not all negative, but smoking is a problem. If you know that there's a substance in it that will affect you, you stay away from it. Simple and easy. Second term can affect you, yes. Not as much as you smoking it yourself, but it can. Like secondhand from cigarettes, yes.
There's several questions on the board, Doc, so I'm going to start taking them. This next one, any precautions with the use of edibles? I'll take them before I take any other questions.
All right. Are the edibles been made with oil? Because edibles have been known to knock out people before, yeah? It depends on the level of the THC within it. So yes, anything with THC in it has to be taken with precaution, right?
Okay.
If you're gonna make it with the CBD, if you're gonna cook it with CBD oil, then the CBD is fine. But once it has THC in it, precaution, because all these side effects will come along with the THC, right? Of note,
Okay.
if you go on, of note, most of what I'm saying, most of the long-term effects that I mentioned has been researched, and they're more frequent in people who use it at least 4 times a week, right? 4 times a week for years. That's when you make it safe. If you smoke, if you eat it once in a while, I don't recommend it, but you're not gonna, any over the age of 25, yeah.
Okay, doctor, there's another
Uh-huh.
question. If a person sees smoking marijuana, how long would it take for that person to get a negative test result?
30 days.
30
A
days.
month. Yeah.
Yeah.
Remember, it is stored in your fat cells also, right? So these fat cells has to be burnt off in order for it not to be in the system. They stay in the system for quite a while. Right? This
Okay.
is how we know a lot of patients about clearly smoke or smoked before they came in, because we can even though we don't catch them smoking or see them smoking, we know they have smoked within the month because of the THC in the blood.
Another question, I believe it's about the tea. You know, so that question is coming up. It says, what if you grow the plant yourself?
Hmm. And use the tea. I'm gonna
Excuse
tell you,
me?
and use the tea. If you use, for example, right? If you use the tea to drink when you have flu or cold, it has been known to break up your cold, right? Here's in Antigua, there are a lot of people, a lot of Adventists who have used the tea previously to break up cold. When you have a fever or flu and you have sore throat and you're stuffy, the marijuana tea can actually be used to help with that. All right. Again, it is not something that you should do daily, because the THC has side effects, right? So there are pros and cons of everything. But I'm not against one-term use of the tea, personally.
Yeah.
Right?
Doctor, I really appreciate your answer a while ago, because I was going to come to that in the end about there are many Seventh-day Adventists using
Yeah.
it and could become addicted. Yeah. So
Remember, it's addictive. That is why I'm mentioning it. So that is why I'm saying, I'm always saying a grain of salt, right? Because it can be addictive. Yes.
next question on the board. Can
Uh-huh.
anything be used to speed up the process of a negative test result after smoking marijuana?
No matter how much exercise. We've had people who try to exercise to burn it off. No. Not tell me you put it up. We've had people who try, because I've explained to patients before that it lasts them for a month and it's in their fat cells. And I've had some before who tried to run it off, run and burn off all the fat cells. Doesn't work. Right?
Okay. What are the negative effects of smoking the electronic cigarette? I don't know what that is, so probably you know.
E-cigarettes, yeah, e-cigarettes, right? The substance within the e-cigarettes are chemical based. Yeah, so you're smoking pure chemical, right? Which means it is extremely, the potency is a lot higher for cancer, right? It's basically it. It is worse than it's worse than smoking marijuana, but you're smoking chemical substances, right? Basically, you can take it like that.
Okay, there's another question. Person said they're late, and but they want to know but I would like to know how are persons making marijuana containing more THC than CBD?
Yeah, you have different types of cannabis plants, right? You have the sativa, you have the indica, and you have the rubellus, and they combine them, right? So you have like 1% of this and 3% of the kind of, yeah, so you can actually combine them differently, increase the level of THC. So when you, let me give an example, right? I have a farm and I test my THC, right? I test this marijuana plant that has a 5%, and I test this other plant that has a 10%, right? I can mix them up and keep mixing, matching until my level of THC. These are happening over the years. You cannot just raise it by 30% in a day, right? It's built up of plants that have high levels over the years to now where we have 34%, right?
Okay, I missed the first question on the board, so I need to apologize to that person. They did brought me back to it. It says the unlocking of the CBD, I want to believe, one by the THC is what caused the high. If yes,
correct.
then
Because
over the years, increase in percentage of THC in marijuana can be deadly, since marijuana decreases the appetite and is a good weight loss method. So they're questions basically.
This is why I presented the key and the lock. The method, this is why it's important to know that it unlocks the CB1 receptors in the brain, right? And the receptors are found within the hippocampus. High concentration of the CB1 receptors are found within the hippocampus and the amygdala, which contain emotion. That is why sometimes you can get very emotional when you smoke, right? And fearful at times. They say sometimes it relaxes you. Let me give an example, right? People smoke marijuana because they're anxious. But what they do not know, right, is that marijuana would temporarily relieve that anxiousness. But after the half-life, the anxiousness now rises even higher than it was before. Right? It's like cigarettes. When you smoke nicotine, every time you use it, it gets worse. So that is why it says it doesn't make you mellow in the long run. Right? Yes. After the half-life, it has gone down. You have the urge, the anxiousness comes back again, and you have the urge to smoke more. Right? Until it becomes addictive like that.
Okay, Doc. My personal question is, would you consider it a narcotic?
I mean, don't answer for me question yet.
I've answered the question. Hold on. Let me answer this one first. Go ahead. What's the question? Is it Nixie?
Yes, Nixie. Okay, you answer the first part. The unlocking of the TBC by the THC. Can you say is what causes the high? What causes the high? So I was saying now, well, if you keep on increasing the THC, that means it can mirror and it can reach a point where it becomes deadly.
Well, there's no known cases of marijuana killing people
okay.
Right? There's no known research case. But I get your point. Right? But there's no known case where they say that research. Don't put it that way.
Marijuana kill anybody.
Yeah,
okay, another question. Since it decreases your appetite for people like me, so who eat plenty, would you recommend it as a weight loss method?
No, because it's addictive. Anything that's addictive should not be used because you will become addicted to it. Anything that is psychoactive or can have a psychoactive effect on the brain, we do not recommend the use of it at all. Right? Long-term use of it.
Thank you.
The question now, if it's a narcotic.
Yes.
I would not put cannabis sativa as a narcotic. The plant itself, but the THC is, yes. Just like we don't put cacao as a narcotic, but we get cocaine from it, right? I won't put THC itself. I mean, cannabis sativa, the plant itself, as a narcotic, but THC is, yes. You understand where I'm coming from, right?
Yes,
We don't ban cacao or the cocoa plant, right? So yes, that's where I'm coming from. But THC itself is a drug.
All right, I have a question. Is it okay to use the hemp? Because I heard you say that it's not bad to, the hemp is not bad as long
Here,
as
if it's okay to use the hemp.
I know, using it as a skincare product.
Can't hear.
Oh, she was asking, is it okay to use hemp products as skincare products?
It's okay, yeah. The answer is why. Why do you think? I explained this before. Why do you think it's okay? Anybody? I mentioned this earlier on.
Said it earlier.
Does anybody know why it's okay to use hemp or why?
Because of the 3%. It's 3%.
0.3%. Yeah, it had a 0.3% of THC, so it barely has any. The THC within it does not really have any does not have a psychoactive effect on the body because of how low it is. Yes, it's okay to use hemp. That's understood, right? I wanted to because this is so touchy in Antigua and the Caribbean. I wanted to make a clarification between the CBD and the THC, right? So hemp, for me, I don't have an issue with it. We can cook with it. We can put the oil in our salads. We can, because it has a low, extremely low level of THC, 0.3%, right? So that level of THC would not have a psychoactive effect on our body. However, marijuana, which is classified as having a higher level of THC, the difference between hemp and marijuana, right? It's a different substance, right?
I'll speak about your presentation in the end. I'll just say it's a good presentation, but I'll speak more about it in the end. You differentiated a lot of the confusion that we have with it, and so there are many persons who still confused because you have separated them hemp with marijuana, and you hear it even in the media when media professionals are talking on the topic.
Correct. It's it is confusing because we put them together all the time, right? We put them together all the time, but science, that's the classification. Hemp is less than 0.3% and marijuana is more, but they both are the same plants, right? Remember I told you the plant has been diversified so much. Back in the old time day in Mexico and India, they used to use the hemp plant to make clothes because the fibers were so strong, right? And they used to smoke it too. They used to smoke the hemp too. But over years, it has changed and they wanted the high. So over years, they've simply all the time developed it in such a way that they increase the THC over the years up to the point to where it is right now.
Next question on the board. Good afternoon, everyone. Great program. Thanks for this invitation to join. My question, are persons with a family history of mental illness more predisposed to mental illness as a result of marijuana use?
Definitely. This is one thing I mentioned. When I say it's a risk, it lowers the age of onset. THC, it lowers the age of onset for schizophrenia, for depression, for anxiety. It's a risk factor involved. The biggest risk factor is actually genes. And I subted it, right? Everybody has a family member with a mental illness in Antigua. Let me tell you that right now. Right? Everybody, even if it's not a close relative, you have a fourth cousin down the line or somebody in your general family that has a mental illness. You may not know, but we have a lot of mental patients in Antigua that is being seen currently. Our hospital has above 130 admitted. And as doctors, we go to Boland's Clinic, Alston's Clinic, Willie Keys Clinic, Clearhawk Clinic, Grace Farm Clinic, Browns Avenue Clinic, to see patients there also. Plus, we have an outpatient department that sees many patients a day. And we have over 100-something patients who we go out in our mobile teams to look for. There are a lot of mental patients within Antigua, and somebody, or everybody knows somebody who has a family member, or they themselves have family members. The risk increases dramatically if you have a family member, or it's in your genes, of having a mental illness and you smoke, especially at a younger age.
Okay, question 2. Is hashish the same as or marijuana?
Hashish is the oil that's created from the sesame female plant. Right? That's understood?
Yeah, I get that.
That's what it is. Right?
I hope that clarifies for the person who asked the question.
Yeah. The sesame plant is actually the female plant with a high concentration of THC in it. Right?
Okay. Okay. Are there any other questions?
Yes, I have a question. I've heard persons saying that the marijuana is good for let me see what it is again. Asthma.
I've heard
is
that too.
That true?
That is not true.
Okay.
That is not true. Anything that is smoked cannot be good for asthma, no matter how you put it. Right? If you drink, there have been people who said if you drink the tea, right? But again, the CBD is the medicinal part of the marijuana, not the THC. Okay? But there's been no research that proved that it has been useful for asthma. But there's people who said smoking it helps with asthma. No, it has not been researched. Maybe in the next few years when they research it, but to this day, it has not been fully researched properly that it has been useful for asthma, right? Wait, another point. Wait, before you go on. Nicotine causes bronchoconstriction. I don't know if I don't want to be too complicated, right? And THC.
Okay, I'm sorry. Can I just ask a question here?
Hold on. When I'm finished, right? Nicotine causes bronchoconstriction, and THC causes bronchodilation. Maybe that's why some people say it helps, right? Is that understood? But there's been no research that shows that that it actually helps in the long term. Yes, I think it is Nixie.
Yes, I invited somebody to come and listen to the session with me this afternoon, and she's here swearing about it because her brother was asthma and had asthma, and from time he started smoking marijuana, they're convinced that he's healed. He hasn't had an asthma attack in years. She's right here listening, so that's why I wanted you to emphasize on that point.
Again, what I mentioned, right? Nicotine, cigarettes, nicotine, the substance, the chemical substance in cigarette has been known to cause bronchoconstriction, and the THC has been known to cause bronchodilation. However, it does not heal anybody of asthma, right? Smoke in your lungs, whenever you smoke anything, right? Even though it causes some temporary bronchodilation, does not heal you from the asthma. With time, over the years, asthma usually becomes less and less and less and less and less, right? So you may find asthma within a young child, but as they get older, it goes away on its own. You're not cured, right? But you see less and less effect of it with time as it passes through, right? That's understood? It's because of the bronchodilation that the THC temporarily gives, but it doesn't cure you from the asthma.
Okay, so there's another question on the board. The same question. So I believe the person would have got the answer, but I'll put it the way it is posted. So what are the persons who swear it helps relieve their asthmatic congestion feeling? And I think you just answered that. It's maybe more mind over matter, but you put it in a scientific explanation. Yes.
Hopefully the bronchodilation is understood. The bronchodilation means the bronchioles within your lungs expand. But when you're expanding it, you're filling it with smoke. You're not filling it with oxygen. right? But the temporary expansion in the bronchiole within your lungs,
Brings relief.
yes, right? You get a little relief from the temporary expansion, but it does not cause increase in the oxygen within your system and within your blood, right? But you get a little relief from the bronchodilation, but it doesn't cure you from asthma. Marijuana doesn't cure you from anything at all.
Can I say something, Doc?
Yes, ma'am. Yes, sir. Tittle.
Yeah, this is not Tittle.
Uh-huh.
Yes, I have a relative who was asthmatic from the time they were 4 years of age.
Uh-huh.
And I don't know, I have to agree with you because now he's in his 30s.
Uh-huh.
He has less attacks of the asthma.
And
he don't need it, and he should be taking the ventilator inhaler and so on. He don't really take anything. And I believe if he was to eat properly, with a more healthy diet, that would have helped him too. But he's doing quite good in his 30s. And he had the first attack when he was 4 years old. And the frequency is less now, you know?
I have a cousin who smokes.
I can agree with you.
I have a cousin who has asthma and smokes, right? Third cousin, we live in my village in Knowles. He has asthma and he's been smoking for years. He still has asthma and he's hitting 28 now. And he still has asthma and he's been smoking 3-4 joints a day. All right? And he still has asthma. Again, it doesn't cure you. It gives you temporary relief because of the bronchodilation. But with the bronchodilation that you get, right? Imagine all the addictive substance that's been added on to that and the THC within the brain, right? So it's actually doing more harm than good to your brain. That is why I don't recommend the use for asthma. I hope, Nixie, understands that, right?
Yeah, I understand. I'm learning. Yes, very good.
All right.
Any more questions? You can either put them on the text board or you can ask your question openly.
Yes, I have a question. Dr. Knowles.
Yes, ma'am.
Thanks for the program. What at least 2 or 3 advice would you give a parent whose teenage child has started to smoke?
Are they listening to me right now? This would be a good thing for them to hear. It is if they've been smoking for a while, right? And they're in the teenage years, it becomes more difficult as time passes by, because again, the THC reduces your cognitive thinking ability, right? So they will say yes, your ability to understand also reduces, all right? I think what you can do is encouragement, explain to them what I've just explained to you a little while ago, the effects of THC, the difference between the CBD and the THC, and see if you can get them to understand something like this. I have some books that I can show you. I have 3 books here on me that I can show you about marijuana. You can buy one and let them read it. Right? This is what we use at work to show our patients, right? So at least when they are able to understand, they can read it. So hope you can see. The first one is Marijuana, the Unbiased Truth About the World's Most Popular Weed. Right? And it's by Kevin Hill. Okay? One of the books that we use.
Doc?
What?
Go ahead. Go ahead.
Now, would you say it would be advisable to have a talk in the sense of educating your child even before about marijuana, even before they get to that stage of usage or want to try it?
Education at an early age is very important, right? So education is the key. you would be unable, I think, for a teenager, you can't really force them to stop, you know. The only thing you can really basically do is educate them, right? Because of how they are in the teenage years, it's harder for you to force them to stop than when they were 5 or 6 or 7, right? But when a teenager reaches teenage years, it's difficult for a parent to forcefully stop them without education, and put it that way, right? Education is the most important thing. This is why I'm recommending the books that we read about Clearview for patients. This is the same one we give them to read while they are up by us. Hopefully they can get some knowledge and understanding about it, right? This is one of the books. Would you like to see all of you I have?
Yes, you can post them up, sir.
This one, I took up a cover with what is called Tell Your Children. Tell Your Children by Alex, you get the name right there, Berenson. Right? Alex Berenson, Tell Your Children. And this book includes a lot of stories about teenagers and marijuana use. A lot of them became violent. A lot of them murdered and ended up in prison. And it goes on to tell you about the marijuana industry in the United States and how it's been affecting the younger generation, right? And the third book is called Marijuana Debunked, right? And I base a lot of my presentation today on it. And this kind of tells you the difference between the CBD and the THC, right? So a lot of people preaching the goodness of health benefits of the marijuana. And yes, it has health benefits, but the marijuana that's been produced now with the THC level of 34%, it is not good at all for you. Right?
Okay, there's some other questions, and I need to welcome the pastors. A few of them are online. Pastor Harper, Pastor Charles.
Some pastors too, yes.
Yes. Some are following on YouTube as well. So,
we're on YouTube too.
Yes.
Right.
A friend of mine just told me that 90% of the young men in Antigua smoke marijuana. So how do we convince our young men to stop?
Education. That's the only way.
Education.
Yes.
Yeah.
The younger you are when you smoke it, all right, the higher chances of having side effects and symptoms, right? That's because the brain is developing, right? So after you hit the age of 25 and after, the side effects become less and less and less because the brain has already fully developed. All the receptors in the brain are already mix and match already, right?
Okay, there are two comments, not necessarily questions. One said, stopping young men, probably to that question I just asked, is who is far in it wouldn't be easy, but those who are open to maybe thinking of it is when we need to reach out to them and the kind of friends they keep. And the second comment is below, some children turn to marijuana as a form of rebellion.
And this show culture, right? They look at it as being cool. So education is important. This is why I agreed for this, right? Education is very important. We need to educate the public on the effects of marijuana use and especially THC use, right?
Yes, one of the things is why we thought of this question, Doc, is that marijuana has been glamorized. Not only outside the church, it would be easy if the problem was outside the church. But some persons who are not, who may not have the knowledge that you have shared and give the confidence that about the tea. So I wasn't surprised. These things are being spoken of loosely in some of our church centers. And as a result, some of our young people are becoming addicted to this substance. And it's sad. And so we need to have a discussion I hear a lot of discussion going on around the young people about all sorts of things. But I think looking at our communities, the various young people you see not looking anywhere, not going to school, this is a topic that we cannot exhaust discussing it and having people who are well informed about the topic discussing it.
I hope the addictive part was understood with the release of the dopamine system, right? Because a lot of I know a lot of people comment and say it is not addictive. I've heard it before many times. A lot of our patients say that they can stop whenever they feel like, and it is usually extremely difficult for them to stop, right? I know a few who've stopped for a week, 2 weeks, but after they fall right back into it again. All right, so I hope I've explained the release of dopamine into the system and how the brain function works that caused the addiction to marijuana. Right? Again, it is not as addictive as cocaine or as crack or as heroin or as most of the opioids that we know, right? But it is addictive because of the secretion of dopamine, which is the feel-good substance within the brain. The high that we get, a lot of us like it, and we go back over and over to get that high.
Yeah, right? Doc, I hope that next week I'll see you somewhere in the youth week discussing this particular topic. Even they ask you late, I hope you consent and make a contribution. This is the most significant problems that our youth are facing in the church. Some people are not really acknowledging it, but it is. And the other behaviors, as I don't know, I'm a layperson, as probably are a result of their involvement or interaction with the plant. I'm going to the board. There are other questions on the board. Comment. It says, unhealthy relationship between husbands and wives in the home can force children to turn to marijuana. Families need to foster good relationship in the home. That's one comment.
Correct. A lot of question too. A lot of remember I said before, right, that drug use or marijuana use is not the only risk factor. You have genetics, family, you have social issues in home and in our community that all also combine together with substance use or substance abuse that actually causes illnesses, right? So it's not just the weed. Most of the time, it's not just the weed alone. It's a bunch of factors that combine together that actually causes illness. Okay?
Understood. Family use and peer pressure also contribute to it. There's another say, so impaired thinking and lower IQ is not an effect of marijuana on persons who start using it after 25. That's the first one. You're after 25. Let me put it as a question.
The younger you are, the greater the... I'm not saying that it cannot happen, but it is because your brain has already fully developed at the age of 25, having any significant side effects, which include impaired thinking, etc., it is less likely to happen. The long-term side effects, but the short-term side effects still do occur. But the long-term side effects are less. The percentage of people suffering from long-term side effects is less due to the fully developed brain already.
Okay, Doc, somebody agreed with me. Yeah, this program needs to be repeated. I am extending an invitation to you, Dr. Knowles, to redo this program in District 4 at your convenience. Yes, this is a message. When I read the program for the Youth Week, I made a comment that I was not in favor of all the discussion because I did not see this topic. And I felt that it needs to be there. And I know I saw the director in this afternoon, so I know he will probably yield to me. I was about to call him, but I was so busy at work, I didn't get around to calling him to say I would love to see this program on. So it says, the next question, Dishon, how can we gain the benefits from the plant to get its CDB? Is there a safe extraction form from dust, or is it best to consume something else that has CBD?
Let me put a pin here, right? Because of the popularity now of CBD, there are pharmacies that are creating synthetic CBD. I do not recommend any form of synthetic chemical or anything at all, right? They are natural forms of CBD which can be used and are extracted from plants. I don't know how they do it. I have not researched that as yet, right? But they are natural forms of CBD which are extracted from plants. Those are safe, and those have a lot of health benefits, right? We can get from the CBD. I'm not aware of how they extract them, unfortunately.
I see Pastor Shalva.
And then I'm not sure if it's boiled down and then extracted from the concentration of the oil that's within it. Yeah.
I see Pastor Shalva have his hand up. We'll be happy to hear your voice, Pastor. So, yes, you may now say something.
All right, good afternoon, everybody. Forgive my appearance. I'm on vacation, but I'm enjoying this particular program. One of the things that I've noticed is that when I have personally tried to talk to persons who I either suspect of using marijuana or I know to be active marijuana users, is they are incredibly defensive. They're fiercely, I guess, they fiercely affirm the use of marijuana. Now, if what you have shared this afternoon is true, I'm hard pressed to see how we go about educating first young people in our church, and then even interested persons who may want to get out off of marijuana outside of church, and then after that, maybe the persons who are perpetuating the use of marijuana within our society, because I see its danger. Additionally, I tend to believe that persons who use marijuana are at a higher risk of withdrawing from life, so to speak.
Correct. Yes.
So that they become less interested in normal activities. They become more irresponsible, whatever the case is. I don't want to believe that I'm judging persons, but that has been my experience. That is what I have seen. So I don't know if you could speak to that. And I'm talking about persons over 25 rather, not just younger persons.
Usually, those who we see over the age of 25 have been smoking for longer, for quite a few years. They may not have been, let me put it this way, right? Not everybody who smokes will get affected heavily, right? Not everybody who consumes marijuana, because there are people who consume 1 or 2 or 3 times a week, right? As I mentioned before, you start to see significant psychological and psychosocial effects if you smoke 4 or more times per week. That's when you start to see strong, the percentage of psychosocial effects become more dramatic, right? 4 or more times a week if you smoke, all right? A lot of our young men smoke every day. I've had one who told us 15 to 20 joints a day, every day for years, right? He's currently up by us. He's one of our patients, right? Every single day. Weed is easily accessed. And remember, when you start smoking, one of the side effects or one of the symptoms that you notice, especially smoking, is as Pastor Henry says, they begin to withdraw from their normal lifestyle, right? A lot becomes seclusive, and they start to, use the Antiguan word, lime around people who do the same thing as them, right? They start to seek similar company. They start to seek similar people who affirm what they believe, even though they believe is wrong. It is extremely difficult to convince a long-time smoker that, as I mentioned before, it's a psychosocial part of marijuana, right? Because of the cognitive impairment that they have, right? As minimal as it may be, right? For people over 25, right? It is difficult to convince them, even if they're showing symptoms, even if you can see it yourself of behavioral changes, of psychiatric changes within them. It is difficult for them to see it themselves because they lack insight. That's what we call it in psychiatry, right? They cannot see that something is wrong with them. No matter how much the community around them is seeing it, no matter how much the church sees it, no matter how much your family sees it, they cannot see it within themselves. They cannot see that they've been going down, right? That their social life has gotten worse, that they're in school, this has gotten worse. It is hard to convince them. Doesn't mean that we should stop. Yeah? But again, education is important. All right?
Dr. Knowles, thank you very much for such an informative presentation. Blessings to you.
That's Pastor Roger, right?
Yes, yes. Blessings to you. The next one is there danger probably in eating the marijuana in sugar cake from the same as smoking?
Yeah, you don't get from smoking it, you get the smoke from it, right? And so you get the buildup in the lungs. But eating it, you still get the levels of THC because the THC is absorbed in the stomach. All right, so you still get the side effects of the THC from eating it. Yes, you still get the high and the psychoactive symptoms from eating the marijuana.
Okay.
Put it in the cookies. You put it in whatever you put it in. You still get the psychoactive substance, the psychoactive symptoms.
Okay. Final.
Doc, how about if you boil it and make tea? I have a friend that does that. Make tea with it for years.
Remember saying, right? I remember 6 stages again, right? It has good use. I am not against. We've used it in the church for fever, for colds, etc. Right? We drink it as tea, and it has been used for fever and colds. Right? When the chikungunya was going around, I've known people who used it. Right? And it temporarily allieves some of the symptoms. The point I'm trying to make is consistent use of it. It becomes addictive. I'm not saying you can't, if you have a fever or cold, you can't drink it, but be careful. We don't know the level of THC in the marijuana in Antigua. We don't know. If we could test it and it becomes less than 5%, right, or less than 0.3%, and its use is safe, then I'm not against its use. Note that. All right. However, we don't know the levels of THC within the marijuana. Temporary use, if you use it to make a tea for your cold, and that's the only thing you have to use for it. All right. I prefer to use garlic, lime, ginger, cayenne pepper, and honey. Mix them up together and drink that. Right? That's what I use when I have cold and fever. Okay, but if you prefer to use the marijuana, I do not recommend its consistent long-term use because the THC has significant psychoactive side effects and symptoms. In any form at all that you use it, in tea, in sugar cake, smoking it, etc.
Okay, can I add something?
Yes.
My sister uses the leaves to make tea. What's the difference between using that and using the bud? The buds to make the tea.
The bud has a higher concentration than the leaves. Yes.
She used the leaves. She mix it with balsam and fever grass, and she makes a tea.
But she drink it every day.
No, not every day. But what I'm saying is that she doesn't use the bud. She doesn't use the bud. She just uses the leaves. So the bud has a higher concentration.
Yes.
Okay.
Right? Most of the smoking is done with that. All right.
Okay. final comment on the text board there. I want to suggest that we make this a matter of serious prayer, starting Youth Week and moving forward, because we are at a crisis level now. And I feel the same way also. Doc, someone is going to come this afternoon to close and to give the closing, the thank you for this afternoon's program. But I want to say I've heard a lot of discussions around marijuana, even on the radio, and it's the most comprehensive and informative session I've ever had. And you did not just come and speak out of the wind; you had your support information, and I think it's today's session values money that we can't afford to pay. But I know God is going to bless you for the work that you're doing, and I think that is. It's good now that we have the virtual sessions, because we can reach people where they're at if we can't get them at church for the sessions. And everything should be done to make sure that we get this message out to really sensitize our parents and our youths, because as you mentioned, that age group is right there. Maybe we're saying all things about persons who get to third form and fourth form and don't go progress. But as you indicated, that is the age group when they start smoking and so forth. And that could be a contributing factor. So we want to thank you. Okay, I'll do that this afternoon, because
before we finish off, right? I want everybody to understand, right? And don't, it's not something that we should fear. Education is important. Okay, education on the marijuana plant is important. It's a plant. I see it just as I see spinach, right? It has its benefits. It has its consequences of use. It's a plant, right? This is why I wanted to specify the difference between the CBD and the THC. All right? And I said before, cannabis is not the only plant that has the CBD. You can find it in echinacea. Echinacea is a tea that we drink a lot, right? You can buy it at the supermarket. You can find it in black pepper. You can find it in sunflower. You can find it in black truffles, right? A lot of stuff that's also been said is that weed is one of the oldest plant known, right? But black truffles has actually been known for hundreds of years before weed was found. And black truffles has actually has a good level of CBD also within it. But my point is trying to make it, it's a plant, right? It has been centralized or over-centralized in our community because we use it a lot, right? And it has been glorified in our community because it has been ingrained in our culture because of those around us who have been used in it, right? Okay, I see a question here. So what should a tree be used for? Again, let me answer it fast, right? CBD has been used to help with nausea from cancer. It has also been used for MS treatment, for pain, nerve pain, consistent nerve pain. It's also been used for that. It doesn't cure cancer. It doesn't cure asthma, but it helps, right? Yes. Right. So again, MS, that's multiple sclerosis, right? It helps with nausea from cancer. It helps with neurotic pain or pain caused by nerves. So there's a lot of benefits to the CBD. But what's important is, as I tried to show out in my presentation early, is that the weed, the marijuana, the cannabis sativa plant, or the cannabis, has been modified so much over the years. And it has been modified to increase the THC, and the function of the THC, the main function is to get you high. It's a psychoactive component of the cannabis plants. So we need to be careful with its use. I'm not gonna ban anybody from using it, right? Be aware of the consequences, or be aware of the side effect of the THC, especially on the young mind, right? So to Leon George, I don't disagree with you, right? If you're over 25 and you use it for cold, or if you have pain, if you have cancer and you have nausea from cancer, I'm not against drinking it for your nausea. That's understood, right? But please be aware of the THC use. They understood. I hope I make it clear. Don't be afraid of it. It is not something with harms, right? Education is important so that we can understand, right? And if we decide to go and use it, we need to understand the consequences behind using it, right? And the dangers associated with. I think that was the point of today's discussion. The dangers behind